I'm Dr. Pushpender Gulia, Consultant Surgical Oncology at Manipal Hospitals, Dwarka. Today, I'll be discussing with you about the head and neck cancers, its causes, its incidence, prevalence, its treatment, newer strategies, and all the things about head and neck cancers. As this is almost 30% of all the cancers in the men in India are head and neck cancers. This itself is a heterogeneous group which includes cancers of the oral cavity, oropharynx, nasopharynx, larynx, hypopharynx, and salivary gland tumors. Other part of the head and neck tumors, they can be like thyroid, they can be esophagus, they can be brain tumors, and they can be parathyroid cancers. But because of the different biology and the different treatments, of course, these are to be discussed separately. Today we will be discussing only about the oral cancer. So oral cancer in India is one of the most common head and neck cancer. The reason we all know, most common reason is the tobacco consumption, which is rampant all across the rural India, which is the chewable tobacco, and in urban India, which is the smoking. Second most common thing is the alcohol consumption, heavy alcohol consumption. And alcohol and tobacco together, they increases the chances of this thing more and more. Other risk factors, like there can be environmental exposure, like the occupational hazards. Others are like there are few infections which are coming up more, like the human papillomavirus infection, which is generally responsible for the oropharyngeal cancers. Others are the Epstein-Barr viruses, which are basically responsible for the nasopharyngeal cancers. So forth and so on. There are different multiple causes which we cannot elaborate in such a small time. So coming on to the oral cancer. Oral cancer comprises of the cancers of the tongue, the buccal mucosa, the palate, the gingiva, retromolar trigones, and outside it can be over the lip. So as we have discussed the causes, so now coming on to the treatment, diagnosis of these tumors. For the diagnosis, most of these tumors, they are basically squamous cell carcinomas, because the aerodigestive tract has a common mucosa, and almost 90 to 95% of these tumors are squamous cell carcinoma, though they behave differently despite having the same common origin. Second part is, for diagnosis, we have to do a biopsy. Biopsy can be either an incision biopsy, it can be an excision biopsy, it can be a punch biopsy. So by doing a biopsy, we took a small piece of the tumor and send it for the examination for the confirmation and the diagnosis. Second is, once we have confirmed that it is a tumor which is coming from either from the tongue or palate or somewhere else, we need to do some radiological investigations. That may include CT or a MRI, and sometimes we use PET-CT also for the whole body scanning. Once we are through with this diagnosis and the staging of the disease, here comes the treatment part. The most common treatment which we entails for oral cavity cancer is the surgical modality. The surgical modality can be in the form of the open surgery, or sometimes we can use robotic surgery also. But most commonly that is for the oropharyngeal and the laryngeal cancers, not for the oral cavity ones. So other different treatment modalities include radiation oncology and the medical oncology, and sometimes nuclear medicine too. Radiation oncology is the primary treatment in the oropharyngeal, in the hypopharyngeal, and in the laryngeal cancers. But in oral cavity, surgery is the primary modality, and we need adjuvant radiotherapy depending upon the stage of the tumor. Now, once we are through with this, that we have diagnosed, we have staged, we have treated, now comes the follow-up and the rehabilitation. That is one of the most important part and one of the most neglected part, as the part of the patient and the part of the doctor. So we have to be very careful about the post-operative rehabilitation. That includes speech and swallowing and other things regarding the appearance of the patient. Yeah, I would like to add, in the end, I would like to add 2 lines on the prevention of this cancer. The most common way of preventing is stopping tobacco consumption, for which we are also, government is also doing, we are also doing some help regarding, we have Counseling sessions are also there for stopping tobacco and for stopping alcohol also. We have a clinical psychologist in-house who can give good counseling regarding these patients. So we have all the facilities in-house, including the PET-CT, CECT, MRI, along with the best of the state-of-the-art radiation oncology machines and the chemo daycare and all the facilities for the surgery, modular OTs, robotic surgery we are also having in Manipal Hospital. So if anybody would like to have a consult regarding their problem, they are welcome to Manipal Hospital. Thank
you. Thanks for watching. If you have learned something, please subscribe to our channel and turn on the notification bell and give it a thumbs up, and don't forget to leave a comment in the comment section below to be the first to get subsequent releases through our channel. And if you're on phone or on tablet, don't forget to like and subscribe and turn on the notification bell as well, and help us share with your friends and family. We love you. Home Kiosk TV.